The portal vein in the liver divides into small branches called portal venules, and this portal venule then further divides into sinusoids, and the blood thus flows from the portal vein through the sinusoids, and from the sinusoids the blood goes to central vein. And if you see here, this is the portal venule or the branch of the portal vein, which has divided into smaller branches called sinusoids. So these are the sinusoids on either side of the cellular plates. These are the cellular plates that run radially like the spokes of a wheel, and on either side of these hepatocytes or cellular plates there are sinusoids. And blood from the hepatic branch of hepatic artery, that is hepatic arteriole, because hepatic artery also divides into small branches called hepatic arterioles, and then the blood flows from the hepatic arterioles, it also flows into the sinusoids. So both the arterial blood and the venous blood mixes in the sinusoids, and then the blood passes through these sinusoids into central vein, and from the central vein the blood is collected by the hepatic veins, and hepatic veins then drain into inferior vena cava. And these cellular plates, so you can see here these hepatocytes are cellular plates. They pour the bile into the bile canaliculi, and the bile flows from the center towards the portal area in opposite direction to the blood flow. So that was about how the portal vein divides into smaller branches, the sinusoids, and how the arterial blood also mixes in the sinusoids, and the blood then flows to the central vein. Now the question comes how the liver is formed. What is the building blocks of the liver? Now if you cut the liver, and you will see the appearance of liver like this, and it appears that this cut section of the liver is made up of liver lobules, but we cannot see it through naked eye, but when we see under the microscope we exactly find that cut section of the liver is made up of liver lobules, or the building blocks of the liver are liver lobules. So this is the cut section of the liver, you can see here, and these are the vessels. So you can see here the cut section of the liver, and you see here the small vessels are also seen, and these small vessels, they are the branches of hepatic artery and branches of portal vein. And what you see here, the surface is like this. It appears that these surfaces are hexagonal. So you can see here it appears that there is like this hexagonal shape, and this liver is actually made up of liver lobules, which I said is hexagonal in shape, which we usually don't see on the gross section, or we don't see by naked eye, but they can exactly be seen under the microscope, and we will find that these liver lobules, which are the building blocks of the liver, are hexagonal in shape. That means having the 6 surfaces. So you can see here, this is the cut section of the liver, and if we look this cut section of the liver under the microscope, then we find that this cut surface of the liver across the liver lobules are also cut, so they appear as hexagonal with 6 surfaces, having the central vein in the center, and it is also having the portal triad consisting of hepatic arteriole, portal venule, and the bile ductule at the corners of these hexagonal surfaces. And what you see here, this whitish, is the connective tissue, or it is the alveolar septa, which comes from the Gilson's capsule. The Gilson's capsule enters into the cells and forms the septa of the lobules. So we have understood that when we cut liver, the liver is made up of liver lobules, which can be seen under the microscope, and these liver lobules are hexagonal in shape, and the liver lobules are separated from each other by this connective tissue. Or so these liver lobules, which are hexagonal in shape, they are the building blocks of the liver. These lobules make the liver, or these lobules form the liver, and these lobules are actually, they are thick, and they are around 2 mm in the length and around 1 mm in diameter. And these hexagonal lobules, in the center of these hexagonal lobules is the central vein, and the 3 vessels, the portal venule and hepatic venule and bile ductule, are at the corners of these hexagonal surfaces. So here you can see the liver lobules, the building blocks of the liver. You can see their size. The size is around 2 mm and the diameter is around 1 mm. And again, at the corners of these hexagonal surfaces of the liver lobule are the portal triads consisting of portal venule, hepatic venule, and bile ductule. And as already said, that the liver is made up of liver lobules. But the question here is, how are the cells of liver arranged in these lobules? The cells of the liver are called hepatocytes, and we have to know the arrangement of hepatocytes in the liver lobule. The cells are arranged like the spokes of a wheel in the hepatic lobules. So this is the hepatic lobule here, and these are the hepatic lobules. So the cells are arranged radially like the spokes of a wheel in the hepatic lobule. And these cells are placed like the sheets or like the cellular plates, and they resemble like the spokes of the wheel. And these cellular plates are 2-row cells. So you can see here, this is the liver lobule structure, which was already shown to you. and this is the hexagonal lobule, one of the hexagonal lobules, and this liver lobule has got cellular plates or hepatocytes in the form of two rows that resemble like the sheets arranged like the spokes of the wheel. And these plates, these cellular plates, are in two rows. So this is the one row, this is the another row of cellular plates, and between these cells there is bile canaliculi, and when the hepatocytes secrete the bile is poured in the bile canaliculi, and from the bile canaliculi they are poured into the bile ductule. We also see here that on either side of these cellular plates, on either side of the hepatocytes, there is sinusoids. So this side there is a sinusoid, and this side of cellular plate there is a sinusoid. That means on either side of these cellular sheets or cellular plates, or on either side of these hepatocytes is the sinusoids. So let me show it here. If we magnify this cellular plate, if we magnify it, we see here the two rows of cells laid like the strip or laid like the plates. These cellular plates or these hepatocytes, in between them is, so in between these cells is bile canaliculi. This is not bile ductule, but this here is bile canaliculi. The bile is poured by the hepatocytes in the bile canaliculi, and then bile canaliculi is connected to the bile ductule. And we also see here that on either side of these cellular plates there is sinusoids. So it can be shown here also. This is the cellular plate, or these are the hepatocytes. So here these are the hepatocytes, and this is the sinusoids. So here the red color is the sinusoids on either side of the hepatocytes. So when shown here, so these are the hepatocytes, and on either side of it or on the side of it there is sinusoid. So this is the sinusoidal vessel. But between the sinusoids and the hepatocytes there is a space. So this is the space, and this space is called space of Dis. Space of Disi or space of Dis. And we also know that there is the endothelial lining on the sinusoids, or these sinusoids are lined by the endothelial cells, and these endothelial lines, they are fenestrated. The endothelial lines are fenestrated. So they got small holes, and through these holes there is some plasma which mixes in the space of Dis, and from the space of Dis the materials are taken by the hepatocytes, or some materials are not taken and they remain in the space of Dis, and then from the space of Dis they can go to the lymphatics. So exchange of materials between the hepatocytes and the sinusoids occurs by the medium of space of Dis, and this space of Dis contains the satellite cells, which are star-shaped cells called satellite cells, and endothelial lining of the sinusoids also contains the Kupffer cells, which are macrophages, which engulf the organisms like bacteria, viruses. And these satellite cells, they are also called as liver lipocytes. They store the fat and they also store vitamin A. You can see on microscopy the liver having the hexagonal lobules. These are the liver lobules, which are hexagonal in shape, and in the center is the central vein, and at the corners of these hexagonal lobules are the portal triads. So this can be shown here, the hexagonal structure of the lobule, and at the corners of this hexagonal lobule is the portal triad consisting of portal vein, bile ductule, and branch of hepatic artery. So on this side you can see here the hexagonal lobule, and this lobule is flooded with hepatocytes, or this lobule is made up of hepatic cells, which are called as hepatocytes. The hepatocytes are in the form of strips or in the form of plates, and these hepatocytes are in double rows. So it contains, this is the one row of the hepatocytes, this is the another row of the hepatocytes. They pass from the central vein to the periphery like the spokes of a wheel. On either side of these strips, of these hepatocyte strips, is the sinusoids. As I said that this sinusoidal lining have got the Kupffer cells, and these Kupffer cells are hepatic macrophages derived from blood monocytes. They lie within the sinusoidal lumen attached to the endothelial surface. They have a bean-shaped nucleus and plump cytoplasm with star-shaped extensions. So you can see here, this is a star-shaped extensions. They are more numerous near the portal tracts. So more numerous here near the portal tracts. These cells respond actively to many types of injury by proliferation and enlargement. The space of this is between the hepatocytes. So these are the hepatocytes, and between the hepatocytes and the sinusoidal lining cells. And this is a zone of intercellular exchange that contains the plasma, scanty connective tissue, and perisinusoidal cells such as hepatic satellite cells. So space of this contains the satellite cells, which are important cells, and these hepatic satellite cells, which are also called as ito cells or interstitial fat storing cells, or hepatic lipocytes. And there are also other cells which are called as pit cells. The satellite cells or the ito cells, they are irregular and lie within the hepatic plates between the bases of hepatocytes. They are difficult to differentiate from sinusoidal lining cells. They are modified resting fibroblasts. that can store fat and vitamin A. So these satellite cells can convert into fibroblasts, and these satellite cells also store fat as well as vitamin A, and under certain conditions they change into fibroblasts. For example, in cases of the chronic liver diseases, because they are converted to fibroblasts, and they then deposit fibers in the liver, so that the liver becomes fibrosed, scarred and shrunk. These satellite cells also produce hepatocyte growth factor and collagen. They play a significant role in hepatic fibrogenesis. The other cells which I said are the pit cells. The recent evidence indicates that pit cells are not endocrine cells but correspond to the large granular lymphocytes and have natural killer cell activity.